But here to talk about that, my good friend Rob Mattacchione. Rob Mattacchione is the CEO and board chairman of Novo Integrated. They are publicly traded under the stock symbol NVOS. And of course, their website, novointegrated.com, that our TV audience is looking at. Rob, boy, you just happened to be at the right place at the right time, or did you plan on this? Because I'll tell you what, the need for decentralized healthcare has never been more prevalent than right this second and this point in time. Talk about that a little bit for us.
Yeah, well, it would be nice for me to say that that is the case, that it was all planned this way. I've been involved in healthcare since 2005. In 2017, we went public, and Novo Integrated Sciences was born. So it's just a sheer coincidence, but it is a message that we've been preaching for forever, really.
You know, the interesting part of this thing is I think everyone wanted to go back to house calls. Remember house calls?
Come on over.
Right. I mean, that makes sense. The doctor's coming over. Okay, you're sick. You're not going to go out.
Yeah.
And risk infection. The problem is we didn't have the technology before, did we, Rob? Talk about that, because medical technology is a key component to the future of healthcare and this decentralized healthcare, where no longer are you going into a facility; they're coming to you.
Yeah, guys, you said it best in terms of describing it as a house call, but really it's a virtual house call. So
Sure.
in effect, it does the same thing. One of the magical components that differentiates it from just a text or a Skype application, something just truly, two-dimensional, is the fact that a lot of the peripherals, a lot of the other technologies that we can bring to the table with remote patient monitoring, and some of the physical people that can come to your home that aren't necessarily doctors that can use these tools, create a very, very high level of interaction where it just didn't exist before.
Yeah, talk about Novo Integrated, because we're looking at a screen here talking about physiotherapy, chiropractic, massage therapy, elder care. How do all these patient care services fold into what you guys are rolling out?
Well, they're all what we consider primary care, ancillary services. So we focus on rehabilitation and rehabilitation in pain in particular, and most conditions that we experience that compromise our health really create a problem with pain. So, we believe that focusing on that starts to create a much better quality of life, even if you're dealing with an illness that can't be treated and, has a terminal outcome. You still have the right to quality of life. So we focus in on that area of care. We also understand that 80% of all health concerns are addressed at that level. We call it the primary care, right?
Right.
And so we focus there. We focus with products around that. And now our energy is not just about physio, chiro, and those things that you've identified, but it's all encompassing. We have a strong group of stakeholders, and stakeholders that provide services. And that interaction through that decentralized platform, but staying connected with one another, is what creates the magic.
So by the way, Rob Mattacchione is our guest. He is the CEO and board chair of a company called Novo Integrated. Stock symbol NVOS. They are publicly traded, and they're also, you can find their information out. We've been looking at their website right there, novointegrated.com.
I'm wondering if I'm maybe in a virtual waiting room, if there are going to be links to outdated articles.
What do you mean?
Because when you're in the doctor's office waiting room, there's old magazines.
Oh, so you're going to be able,
like,
while you're in the waiting room, be able to read old highlights?
Yeah.
Or Sports Illustrated
Boys Life from
year?
1968.
Well, no, that's not going to happen.
I'm just.
But is it a Zoom type technology where look at you yourself. As James Herson was on, we're sitting in a virtual waiting room before you had a virtual green room before you had it on the air. Rob, is it going to be? Is that the same sort of rollout that we're going to see here, 2021 and beyond?
Yeah, I mean, you're seeing that right now, but I think what we're trying to do is take it another level. There's a phase approach to the technology in that you can actually get to something before this interaction occurs, where you're effectively running an AI platform that creates an evaluation prior to engaging a practitioner or a doctor of any kind, and then rolling into this, so that there's already an existing data field and there isn't a lot of wasted time. You mentioned that you don't mind spending the money so to have a specialized type of healthcare.
Sure.
Well, the reality is most people who pay for it, and regulators, governments, and alike, don't like to spend the money. And this really creates the most efficient way to streamline healthcare so that there's effective use of time, especially expensive time, doctor time, specialist time, these types of things.
Well, look, I don't like to spend it, but I got to the point where I was sucking up. It happened when I started having my second knee surgery, and I was like sucking my life away, sitting in a doctor's office, and I thought to myself, you know, so I'm going to budget for this. I mean, if I got to go out to dinner 2 less times a month, or if I got to go, honest to goodness, it was like, okay, fine, I'll just budget for it, because it was more, you know, that lost time is lost productivity for me.
Can't get it back.
Speaking of that, you know, there is that model of non-reactive care, Rob, where you're not going in because you broke an arm, but it's the preventative care because, well, you want to go get a vaccine, for example. Does that also apply in the new world of decentralized healthcare?
Yeah, you know, for us it does, because one of the features that we bring to the table is you engage in signing up for an app. And that app stays connected to you, not just when you need something, but when you start to, you know, we're an interesting creature that we only react to something when it's happening. So if we feel the pain, we want to deal with it. But if we're reminded of certain things, you know, you take your car for an oil change regularly, you wash it, you do all these preventative things, and yet for ourselves, we kind of put that on the shelf. Our technology and our interaction and staying connected to our patients is a function of keeping that reminder in place, you know, reminding them of the products that they need to engage in, the nutrition, diet, all these things. And the technology that interfaces and creates that connection allows a seamless interaction.
Hey, Rob, before I let you out of here today, and I love that you're able to come back with us often, I have to ask, so with a vaccine impending, we're going to have our sleeves rolled up here literally over the next, say, 3 to 6 months. How is that playing into your business model going forward?
Yeah, we're excited about that opportunity, and we believe that moreover, you know, you got the rollout of the vaccine, but then the follow-up behind it.
Yeah, right.
And how do you deal with that? So we believe that we're going to be critical and key to that follow-up behind the rollout of the vaccination.
No, that's a great
Vaccinations are a necessary, you know, piece of healthcare tomorrow.
Yeah, I never thought about that. You know, the follow-up part of it. That makes even more sense. Rob, thanks so much, pal. We'll see you next time.
Yeah.
Rob Mattacchione.
Maybe he can send us a dose.
You want a what?
I'm not going to do it. You know, the new